Omnicare for Everyone, presented by Craig Cisak, Walsh University MBA 721 for Professor Cleland. The situation is healthcare in the United States continues to be challenged by accessibility, cost containment, affordability, and value. There have been a number of policy changes over the past half century to improve our healthcare system, but none comprehensive enough to address all of our issues. Politicians in Washington continue to use healthcare as a negotiating chip. Private health insurance companies are highly profitable, and CEOs have had record-breaking salaries and bonuses on the backs of working Americans. The gap in coverage between groups eligible for Medicaid, Medicare, and children's health insurance plans continues to expand. The Patient Protection and Affordable Care Act of 2010 was a healthcare reform bill. It looked to change the delivery of healthcare as we know it. The 1,000-page document drastically changed the landscape of healthcare by improving accessibility for millions of uninsured individuals. This plan covered more individuals and families than ever before. It was the largest healthcare initiative since the implementation of Medicare in the 1960s. It intended to drive down costs and increase value, establish initiatives to improve quality of care, and made great strides towards improving our healthcare delivery system, but left many gaps to fill. Some of the pros of the Patient Protection and Affordable Care Act of 2010 included increased coverage by 20 million individuals, commenced value for healthcare initiatives, provided tax credits for up to 400% of the federal poverty level, required coverage of preventative care, expanded Medicaid to 138% of the federal poverty level, prohibited rescission of insurances, increased age for children to remain on their parents' insurance plan through age 26, established a pre-existing conditions pool, and removed the lifetime maximum dollar limits. Now, the cons for the Patient Protection and Affordable Care Act of 2010 included in 2013, the pre-existing condition plan lost $2 billion. The high-risk pools lose billions of dollars every year. The website was too complex for the average citizen to navigate. Higher than average deductible plans, expensive premiums, fines, lack of government funding, extremely complicated policy to navigate through for the politicians, the policyholders, and insurance companies, and still left millions uninsured for various reasons. My proposal is Omnicare for Everyone is a federally funded and sponsored program for all U.S. individuals and families who do not qualify for another government-sponsored program or employee group health insurance. It improves upon the Affordable Care Act by maintaining lifetime maximum costs, keeping preventative services coverage, retaining dependent age limit of 26 years old, and continuing quality and value initiatives. It will remove the marketplace, health exchanges, high-risk pools, and pre-existing condition plans. My proposal replicates Medicare, a federally sponsored and administered program which has proven its effectiveness for decades. My target population includes the uninsured, underinsured, working poor, and anyone between employment. The financing of Omnicare for Everyone includes increasing the Medicare tax by 1% for all employees and employers. That would be split at 50% each, so 0.5%. Beneficiaries pay 1% for an individual plan, 1.5% for a family plan if an employer does not provide group health insurance. An unemployed individual plan would pay 1.5% plus the 0.5%, so a total of 2%. And utilizing the federal minimum wage, they would pay 2% of $15,080 per year. Again, the family plan of an unemployed individual would be 1.5% plus the 1%, so a total of 2.5% of the federal minimum wage. Again, so 2.5% of $15,080. 20 million individuals covered under the ACA would be converted to Omnicare for Everyone, could generate up to $6 billion for the federal government's coffers, contributing to federally sponsored health insurance plans in order to sustain the programs for years to come. It also creates personal responsibility and accountability for individuals and their families. The Congressional Budget Office findings look to support Omnicare for Everyone. Omnicare for Everyone legislation is a game changer for public health care policy by providing access, affordability, sustainability, value, accountability, increased coverage for more Americans, improved simplicity of acquiring health care, solvency of federally funded health insurance programs, reduced financial burden on hospitals, physicians, and community. Omnicare for Everyone will move the U.S. closer towards universal health care, but in a reasonable and responsible manner. Support for Omnicare for Everyone would be garnered from Democrats in Congress and many moderates in Congress as well. Professional associations such as the American Hospital Association, American Medical Association, American College of Healthcare Executives, patient advocacy groups, the working poor, underinsured, uninsured, and unemployed individuals. Thank you very much.